Hi there. My name is Cassandra Cannon. I'm a licensed clinical psychologist, and I am an EMDRIA approved consultant, as well as approved by the APA as a sponsor to provide continuing education courses. And I released a previous video about a couple things you should know before you dive into addiction recovery work, about the kind of some generalities about the culture there in addiction recovery, some things you might run into if you haven't really had any experience in helping people address substance use or problematic behaviors. Today, I wanted to talk to you a little bit about some things that you're going to need to assess and evaluate with your client to help you decide which EMDR protocol to do. And there are two types of EMDR protocol when it comes to addiction behavior. There's just the standard protocol that you would use to address any traumas that might be related to substance use or that might be driving substance use or problematic behaviors. And there's also some addiction-focused protocols. And one of the things I'll see a lot on the EMDRIA listserv is people saying, "Hey, I've heard of this addiction-focused protocol. What do you think?" And there's too much nuance to really answer that question because it's going to depend on your client and what their unique factors are. So, some things that you would want to know about your client before you start deciding on a protocol, obviously, is first is if they're stable enough to engage in EMDR. And I do have a readiness checklist for not only EMDR, that's a separate checklist, but also a readiness checklist for substance use treatment. But you want to understand what's driving the problematic behavior or the abuse. You want to know what triggers it, and you want to know what their coping skills are. You want to understand what their support system is, and that will help you decide which protocols to use. And I do have a target selection um, digital download that you can give to clients before sessions if they're up for it. If it's too triggering for them, then I wouldn't want them to do that. But it can kind of be a shortcut for you and really help you with your case conceptualization. And there's also one for you as a clinician that you could just ask these questions. And as you go through this form, it can help you conceptualize what's most important. And so some questions to help you as you're formulating the plan is when did the problem get larger? When did the problem feel unmanageable? Was there something going on that immediately preceded the increase of your substance use or engagement in problematic behavior? Other things that you really need to understand are triggers. So there's external triggers and internal triggers. And external triggers are things in the outside world that might trigger someone to drink, use, engage in a problematic behavior. So an external trigger could be particular location, a freeway exit, a street, a particular grocery store, could be people, it could be time of day. So those are more external triggers. And then internal triggers would be more emotions or like emotions you're trying to avoid or like a feeling that you're trying to obtain or attain that you're not feeling, like confidence, belonging. So it's important to understand, does your client struggle more with external triggers? Do they struggle more with the internal triggers? And those three clusters, like when did the problem get bigger, external and internal triggers, those will be a big part of helping you begin your treatment plan and choose which protocol. There are other protocols that you're going to use based on motivation, and we'll get into that. I'm going to do another video about just kind of a few of the addiction focused protocols and when is a good idea to use those. Um, and so that will be next. But the clinician handout and the client handout for problematic and addictive behaviors, that is a really good place to start to help you conceptualize. And you can find that if you go to my website and you click therapist tools, it'll take you to my Thinkific platform. Also, if you're interested in really doing a deep dive, again, I have a 2-hour self-paced continuing education course, and you can find that also on my website. And that one's called Applying EMDR to Substance Use Treatment. Hope this was helpful.